I'm Caroline Moore, I'm a urologist in London. So after you've had radiation treatment, you'll be having regular blood tests for the PSA, the prostate specific antigen, and sometimes the testosterone. And if the PSA starts to rise, then your oncologist will look at whether or not you need some more tests to look into things. We know that any treatment for prostate cancer can fail, whether that's radiation, surgery, or focal therapy. So there's always a backup treatment that can be used if the first treatment isn't enough. So I would start with a multiparametric MRI scan, and after that the next step might be a biopsy targeted to suspicious and non-suspicious areas on the MRI. And in my practice we would also do a PSMA PET scan to see if there's any cancer outside of the prostate. So treatment options, if you do need more treatment after radiotherapy, will be dependent on the cancer, whether it's inside the prostate only or whether there's also some cancer outside of the prostate. And it will also be dependent on your general health and fitness. So some men might be suitable to have a radical prostatectomy after radiotherapy. That really would be a minority of men. Those who've had cancer outside of the prostate might look at hormone treatment, and some men with cancer only in the prostate might be able to look at the option of focal therapy. So any second treatment or salvage treatment for prostate cancer is more challenging than the same modality used as a first treatment. So the side effects for salvage focal therapy, that's focal therapy after radiotherapy, can be a little worse than focal therapy as a first option. So side effects from salvage focal therapy, there is a low risk of urine leakage. In our practice that's about 1 to 2%, so still a low risk. Many men have noticed an impact on sexual function already, but if they have got preserved sexual function after radiotherapy, they may well notice an impact after focal therapy. So the long-term prognosis for men who've had focal therapy after radiotherapy will depend on the risk of disease prior to the focal therapy. So for many men it will hold the disease for a long time. For some men there will still be a chance of further development of the disease inside or outside of the prostate, and continued monitoring is really important. After you've had focal therapy, you'll be monitored with a combination of PSA blood tests, MRI, and sometimes biopsies. We would say that you've had a cancer recurrence if there is cancer on the biopsy, and very often that biopsy will be prompted by an MRI scan that looks suspicious. So some of the reasons that you might get a cancer after you've had focal therapy, the commonest reason is that the cancer has come back in the same position or just at the edge of treatment. A less common reason is that you've developed a new cancer in another part of the prostate. So the treatment options, if you've had one focal therapy and the cancer's come back, will depend on where exactly the cancer is, what the grade of the cancer is, and whether there's any other factors that need to be considered. In our practice in London, the commonest second treatment after a focal treatment is another of the same focal treatment, and that happens to about 1 in 5 men by 5 years. But we also know that about 1 in 15 men need a bigger treatment, such as surgery or radiotherapy. So any treatment that's done after an initial treatment in prostate cancer is likely to have more side effects than the same thing done as a first treatment option. So the side effects of any subsequent treatment would depend on what exactly that treatment is. We know that when men have a second focal therapy in the same place as the original one, there's very little in the way of additional side effects. So after a focal therapy that needs a second treatment, you'll continue to be monitored because some men will need to have more treatment in the future. So it's important that you keep up with your monitoring tests.